Hi guys, welcome back to our videos. I hope you guys have been watching, have been learning, have been paying attention. Yes, so today basically we'll be covering chapter 24 in your textbooks, that is endodontics. This presentation is on etudo. Yes, there's a couple of them. Please just download all of them. They are learning outcomes under chapter 24. Please know them, please go through them. They have your learning objectives, telling you like what you are expected to know in terms of the instructions you have to give patients after endodontic appointments, the type of materials used in different endodontic procedures, the ability to define and identify certain materials and instruments, and so on and so forth. So please go through all of those learning outcomes. They are there to assist you. Under endodontics, you will also notice there is a presentation from Dr. Oosthuizen. I'm going to use the Cengage presentation. That's what we're going to go through. And then after that, I'm just going to browse again through Dr. Oosthuizen's slides. If there's anything that we did not cover in this Cengage presentation, then I'll just go to her notes and I'll tell you what I think you should know or what we did not cover related to this particular topic, okay? But for now, download the PowerPoint presentation under Unit 13, that's endodontics. We're going to be doing the Cengage presentation, but then I'm also going to go through hers just to make sure I didn't miss anything, okay? And then from there, you're going to also find a flyer, a 7-step flyer for endodontics. You can use those headings and make summaries for yourselves, because if you know those the 7 headings, the material used, what is expected for you, from you, the different types of procedures, you should be fine for this particular chapter. And then from there, there's also a couple of videos so that you guys can orientate yourselves on what root canal procedures are and how they are done under Unit 13. So please also go through those videos. And then yes, we're about to start. So what is endodontics, ladies and gentlemen? So according to this slide, it is a branch of dentistry that deals with the diagnosis and treatment of diseases of the pulp as well as the periapical tissue. Okay, so now these are normally in instances where a tooth is so damaged that it actually causes nerve damage or damage of those periapical tissues. So we're basically trying to get in there and treat them. So normally, guys, when a tooth comes in, every tooth an endo tooth, if I can put it that way, has 2 diagnoses. So the dentist has to give a periapical diagnosis of the tooth as well as a pulpal diagnosis of the tooth. Okay, so that's basically what we are attempting to do with this particular branch of dentistry. So from there, it discusses the progress of pulpal and periapical disease. So we're going to start off with a vital pulp. So a vital pulp is basically, guys, a healthy pulp, caries-free, disease-free, any of your teeth that don't give you problems, I could say that is typical of a vital pulp, okay? Vital pulps are also characterized as teeth that have sustained either injury as well as any form of infection, but once that stimuli or once that source of either the injury or the infection is removed, the pulp heals. So a pulp that has the ability to still heal is still known as a vital pulp. I hope that makes sense. So like I said, they say it's a healthy pulp. It may be inflamed and it is capable of healing after an irritant is removed. So an irritant, ladies and gentlemen, normally would be caries or dental materials that we've placed that are causing irritation for that pulp. But once you have removed that and the pulp heals or has the ability to heal, is known as a vital pulp. And then from there, a non-vital pulp, they define as a tooth that no longer responds to stimuli. So a pulp's ability to recover depends on 2 things. One, it is the duration of the infection or the injury, as well as the severity of the infection or the injury. So sometimes if, let's say, the tooth has is severely grossly carious, so it has a very, very big infection, and the pulp cannot fight against that infection, then it will become like a non-vital pulp. Or for example, if a person has sustained injury, let's say they hit you at Cubana, poof, and then it was so painful that your tooth could not recover from that injury or that fist, then basically would then be also diagnosed as a non-vital pulp. So it depends. Either the person has sat, let's say, with the carious or the injured tooth for a long time, or that one incident was so detrimental that the pulp could not recover. That is then known as a non-vital pulp. Okay, so reversible pulpitis. So a reversible pulpitis is basically an inflamed pulp that is able to heal when the irritant is moved. I think I've basically covered that. So this is a tooth now that has either experienced injury or experienced infection, but once you remove that, it could heal. Then we then call it a reversible pulpitis. So the ability to heal after we've removed the cause of the problem. So normally such teeth would be sensitive to both heat and cold, but especially with cold. Heat is a bit of a poorer diagnosis for that tooth, but especially with cold sensitivity, that's normally a big sign of the tooth then having reverse pulpitis. So the causes would be caries, enamel fracture, as well as occlusal atresion. Okay, so those are some of the causes that could cause a reversible pulpitis. Even with caries, like I mentioned before, it depends on the severity or how long the infectious process has undergone. That will determine the reversibility of the pulpitis. So normally with a tooth that has a reversible pulpitis, you remove the cause of injury or the cause of infection, and then we place a sedative material such as calcinol. But calcinol, ladies and gentlemen, please remember, is mainly used under amalgams, okay, so that we can just smooth and sedate the pulp. So we use materials such as zinc oxide eugenals, okay, never mind as temporary materials, but calcinol in this instance as a base to help protect and sedate that pulp. So those are some of the sedative materials that we can use to help that pulp heal and for the tooth to stay problem free, essentially. Okay, now with irreversible pulpitis, this is a tooth that has encountered so much injury or infection that it cannot recover from that injury or infection. That is then known as irreversible pulpitis. So when a patient comes in, like when they tell you they have pain, guys, it's very important for you to ask. These are the important questions that you should ask, like the type of pain that you are experiencing, okay? So normally with patients that have irreversible pulpitis, they'll tell you that maybe the pain is like short and sharp, like, you see, or it can be like dull and continuous. They'll feel like, no man, something is wrong, and it stops and then it comes back, it stops and it comes back. So that would be a short and sharp or dull and continuous. Normally with dull and continuous pain, it's normally people who have problems with a said tooth, especially at night. So they'll tell you, yo, when I'm about to sleep, this pain is like dull and constant, okay? Those are then some of the indications for an irreversible pulpitis. It is normally especially sensitive to heat, or sometimes it's not even sensitive to any stimulus at all, okay? So at this stage, our pulp is so damaged that it cannot heal itself, okay? Normally with such teeth, unfortunately, there's one of two options. It's either we do a root canal treatment or we extract the tooth. So those are some of the options that you will be presenting to your patient, okay? So like I said, the symptoms, the tooth undergoes thermal sensitivity, like I'm saying, very sensitive to like heat. They'll tell you, when I drink hot things or eat hot things, yeah, I just feel a pain that just does not go away, okay? And then from there, what's the treatment? It is to remove the irritant and place a sedative dressing, like I said, either extraction or a root canal. Okay, so pulp irritants leading to irreversible pulpitis. So these include advanced dental decay. So a tooth is so grossly carious that it's basically, the caries are basically into the pulp, or they're quite deep into the dentinal aspect of our tooth. Then of course that could lead to an irreversible pulpitis. Impact trauma, this would be like your car accidents, or you guys, you know, bumping yourself with fist at Cubana, things to that effect, okay? And then fractures. Sometimes when a patient undergoes injury, especially to the jaw, it tends to normally crack in between teeth, okay? Or you lose that tooth whatsoever, or it breaks into half, depending on the type of accident it is. So in such cases, the tooth undergoes irreversible pulpitis. The infection or the trauma was so bad that it cannot recover. So unfortunately, that tooth has a poor prognosis and may need to be extracted, okay? Then from there, they talk about invasive restorative procedures. Like sometimes if a dentist decides to do like a deep filling that's very close to the pulp, because you need to remember things such as your fast 10 piece, they release heat. So when they release heat, you're basically increasing the heat or the irritant of that pulp, okay? So then that tooth does not recover. Especially there's a lot of dentists, because sedative materials are expensive, they do not place sedative materials under their restoration. So then that further causes the pulp to not be able to recover, okay? And that would then cause an irreversible pulpitis. So you might do a filling on Wednesday, then the patient comes back on Saturday and they're like, no, I'm still experiencing pain even after you've done the filling, okay? And then adverse reaction to dental materials, like we were saying in all the previous videos that it is very important for you to take history. So if you suspect that the patient is maybe allergic to something, or even things such as resins, okay, just by placing a composite, some people have like adverse reactions to resins, and then that could actually even cause pulpal damage. So those are some of the things that could cause a patient to come back. So the next slide basically, guys, goes back to the irreversible pulpitis that I explained again. So that is basically a result or prolonged inflammation, and then the pulpal tissue is unable to heal. So it depends. It's either very severe or it's been there for a long time, so the pulp does not heal. Like I mentioned before, it's dull and continuous, or it can be short and sharp, and then you can either extract or do root canal treatment. It will depend on what the patient goes for, what their medical aids are willing to pay, or if the patient is actually willing to pay cash for that procedure. So we just tell them the options, and then it's up to then the patient to decide that, okay, this is the procedure that I will elect to do. Okay, and then from there, ladies and gentlemen, we have pulpal necrosis. Okay, so pulpal necrosis normally stems as a result of irreversible pulpitis. So like we said, irreversible pulpitis, the pulp cannot heal itself. So what happens? Then the pulpal cells begin to die. So that is basically known as pulpal necrosis. Okay, so all this necrotic tissue basically forms an exudate in the pulp, let's say pus or gas within the pulp of the tooth. Okay, and then normally after this has occurred, it can either be released through the caries into the oral cavity, which is slow, and it slows down the process of pulpal necrosis, or sometimes it literally goes to the periapical area. Sometimes a fistula can form. So a fistula is basically like a little passage that tries to like drain abscess into the oral cavity. Okay, and then sometimes this happens from a high concentration. It moves from a place of a high concentration to a low concentration, so it basically forms like a little gumball in the tissue. So sometimes if you tell a patient to like open, you're going to like see this little circle, yeah, and then basically that's like the little gumball that it forms. The symptoms for a pulpal necrosis are very much similar to an irreversible pulpitis in terms of either a short sharp pain or a dull and continuous pain, and they are pretty much treated the same. It's either we do a root canal treatment or even an extraction. So yeah, like I said, the pus and gas form in the pulp chamber, and the process is slowed if the pressure, so basically the pressure that occurred in the pulp of the tooth is released through a fistula. Like I said, it is that passage that tries to drain the abscess, or if it is released through the caries, in an upward motion into the oral cavity. So those are one of the two options. Okay, and then from there we have periapical diseases, so diseases that affect the periapical area of a tooth. So we have apical periodontitis as well as periapical abscess. Okay guys, with apical periodontitis, this is pulpal inflammation that has spread to our periapical tissues. So then from there, one of two things can happen. It can either be acute or it can be chronic. In the acute instance, so acute apical periodontitis is namely characterized by the patient complaining of maybe swelling, the tooth being sensitive to touch, it may be quite painful, like a short sharp pain. Yeah, so normally once you remove the source of the irritant, then the periodontitis can resolve. However, ladies and gentlemen, if we do not remove the irritant in an acute apical periodontitis, this acute apical periodontitis then becomes chronic. So in the chronic version of this type of infection, it is normally characterized by little to no pain. Okay, and then by it not having any form of pain, one of two things can happen. You will see in your radiograph the destruction of the lamina dura as well as the destruction of the periapical tissue. Okay, so then one of two things can either form. You can either have the formation of granuloma. So granuloma, basically it is a tumor filled with granulation tissue. So you remember all those cells basically that were created during the inflammatory process. Yeah, that's like an accumulation of those cells basically forming a tumor basically filled with granulation tissue. So that's how you get a granuloma. Or you can either find a cyst. So a cyst is basically a fluid filled or a semi-solid filled, and it is usually surrounded by epithelial cells. So those are some of the things that you will see periapically or radiographically when you look for apical periodontitis.